Hi. I'm robo-Suzie and today I'll talk to you about complications of diabetes. Also don't forget to check out the link below, to find out how this guy reversed his diabetes. Turns out, the diabetes industry is selling us fake research. But back to our topic. Diabetes is a disease that causes the blood glucose level to shoot up. The food we eat gets converted into sugar or glucose, and our body uses it for energy. Pancreas is an organ located near the stomach which is responsible for producing the hormone insulin so that the glucose can get into the cells of the body. For the person suffering from diabetes, the body either does not produce sufficient insulin, or is not able to use it efficiently, causing the sugar in the blood to build up. Some of the common symptoms of diabetes include excessive thirst, unexplained weight loss, frequent urination, dry skin, sudden vision changes, extreme hunger, numbness or tingling in feet and hands, sores that take time to heal, feeling tired easily and more infections than usual. Common complications of diabetes. The person suffering from diabetes is twice more likely to have a stroke or heart disease. People with diabetes also have stroke or heart disease at the earlier age as compared to other people. The high level of blood sugar along with instability of the hormones and blood vessels can cause some changes in the body. If you are suffering from diabetes and your blood sugar level is usually too high, it can lead to several complications of diabetes. This disease starts causing problems with other organs and body parts such as nerves, kidneys, eyes and feet. Having diabetes also puts you at the higher risk of developing joint and bone disorders. Over long term, the complications of diabetes include digestive problems, skin problems, problems with gums and teeth and sexual dysfunction. Very low or high levels of blood sugar can also lead to emergency situations. The cause could be certain medications, underlying infection or medicines that you might be taking to control the diabetes. Short-term complications of diabetes such as hypoglycemia, ketoacidosis, hyperosmolar syndrome and hyperglycemia can happen quickly. The patient must be aware of the associated signs and symptoms, and what needs to be done to reverse them. Kidney disease is one of the long-term complications of diabetes, and this is called nephropathy. Excessive levels of blood glucose causes damage to the delicate blood vessels of kidneys that are responsible for filtering the toxins from our bodies. When this does not happen, the toxins build up in the blood. One of the lesser-known complications of diabetes is depression, and studies have found that people with diabetes are more susceptible to depression. Studies also indicate that diabetic people who are depressed are at the higher risk of developing complications of diabetes such as stroke, blindness, kidney failure and heart attack. Another complication of diabetes is the periodontal disease that can lead to tooth loss. This disease is more common among 30% of the people in the age group of 19 years or older suffering from type 1 disease. Another acute complication of diabetes is ketoacidosis, where lack of insulin leads to buildup of ketoacids. Excessive ketones cause the diabetic ketoacidosis, which can be life-threatening. For babies born to women having diabetes, the risk of developing major congenital malformations is higher. Diabetics are at the higher risk of developing certain infections such as asymptomatic bacteria, reactivation tuberculosis, lower extremity infections, group B streptococcal infection and infections in surgical wounds. Digestive disorders are yet another complication of diabetes, and diabetics are more likely to develop diverticulitis, ulcers, abdominal pain, irritable bowel syndrome, diarrhea, constipation and gallstones. If the blood sugar falls below normal levels, the condition called hypoglycemia can occur. If too much insulin is given, if the person misses the meal, or does more exercise, this condition may result. It deprives brain of the essential energy. Dizziness, mild hunger, palpitation, sweating, mental confusion and even loss of consciousness may occur. Always consult your doctor before using this information. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.